Good morning, everyone. We are still bringing people in from the waiting room. My name is Dr. Monica McLemore, and I'm an associate professor in the Family Healthcare Nursing Department at the University of California, San Francisco. Welcome, welcome, welcome. I use she and her pronouns, and you have my consent to be able to you post on social media, tweet, chat, Instagram, Facebook, whatever you use, because I think this is going to be a highly interesting and interactive session today that has been organized by a colleague, collaborator, and friend and postdoctoral scholar I'm lucky enough to work with, Dr. Renée Mehra. And we are really excited to be able to talk to you today about what I think is one of the most pressing issues of our time, which is the impact of policing on pregnant, capable people. I will be serving as the moderator today, as well as the timekeeper and the facilitator. And I'm really, really fortunate that three people who I really like, admire, and respect have pulled together some content that I think is super important that we discuss as a public health community. We are going to talk through quantitative and qualitative research on actual and anticipated experiences of police violence, as well as personal and vicarious negative experiences with the police. And panelists will discuss the association between the exposure to neighborhood police violence and adverse health outcomes, and how police-related experiences of Black pregnant capable people may influence their future and current healthcare decisions and pregnancies. We are also going to talk a little bit about interventions and strategies that are community generated that should help to resolve the impact of violent policing on pregnant capable people. I'm fortunate enough to be able to introduce Dr. Alyasah. They use they, them, and their pronouns. They are an associate professor of sociology at Emory University and the executive director and founder of the Race and Policing Project. They are a widely published and renowned medical sociologist and social psychologist, and they assess the political economy of race, neighborhoods, and health, advancing research methods for quantifying systematic racism or systemic racism and hypermarginality. Their research has garnered support and recognition from the National Institutes of Health, the Ford Foundation, the National Science Foundation, and many others. And they were named the 2021 Georgia Sociologist of the Year, and Planned Parenthood designated them the future innovator and visionary who will transform Black communities in 2016. They received their postdoctoral training in demography from the Population Studies Center at the University of Pennsylvania, PhD and Masters of Arts in Sociology from Indiana University, and their baccalaureate summa cum laude in sociology from the University of Florida with a minor in women's studies. We will hear from them after we hear from Dr. Renée Mehra. Dr. Renée Mehra is an actions postdoctoral scholar at UCSF, and they explore the social and structure factors that influence race and ethnic inequities in maternal and infant health. She uses she and her pronouns, and she also uses mixed methods research to examine policies, programs, and healthcare delivery models that may reduce these inequities. She also uses mixed methods to evaluate community health workers, doulas, and home visiting programs for reproductive age people. And she uses community engaged research to really understand the facilitators and barriers to becoming a midwife and the practice of midwifery. And then finally, but not least, we will hear from Dr. Toni Bond, who received her doctoral degree in philosophy in religion, ethics, and society from Claremont School of Theology. She uses she and her pronouns. She is a womanist ethicist and expert in the field of reproductive justice, and was one of the 12 Black women who coined the term reproductive justice in 1994. Her research is informed by reproductive justice and is situated at the intersections of religious and reproductive and sexual justice. She is advancing the field of reproductive justice through her qualitative research on the impact of oppressive theological doctrines in the reproductive and sexual lives of Black women. And Dr. Bond is also researching the unique forms of harassment and violence that are experienced by abortion care providers of color. She has 3 streams of work, and currently they are aimed at, number 1, identifying the number of abortion care providers of color in the United States. Number 2, collecting their oral narratives about the harassment they have experienced by anti-choice proponents who use race and religion as tactics. And number 3, developing resources to support abortion care providers of color who experience racially and religiously based harassment. So with that, I will turn it over to Dr. Mehra, then we will hear from Dr. Sewell, and then we will hear from Dr. Bond. Thank you for being here, and I look forward to this exciting panel and this discussion. Dr. Mehra.
Yes, thanks, Dr. McLemore, for the introduction. So I'm going to pull up the slides that I'd like to share with you today. Everyone can see them.
Yes.
Great. So I'd like to share with you today the words of Black pregnant women on their experiences, anticipation, and fear around police brutality. And what emerged from interviews with Black pregnant women was that police shootings seem to be a main issue, and that Black pregnant women anticipate police brutality towards their children even before their children are born. So in response to the question, what are you going to tell your son about growing up as an African American in your neighborhood? One participant replied, police shootings. Now that seems to be the main issue as opposed to anything else. The main concern is just him growing up African American as far as when he gets older. We watch the news and he asks questions and then I answer them. Like whenever someone gets killed, he doesn't even specify black or white. It's just if I'm watching the news and he happens to come in the room, he'll ask me, why did they do that? Why did they shoot that man? Or why did this happen? I'm like, I don't know why they would do that. Some people are just evil and they feel as though they have the right to take another person's life. So today I'm going to share the findings on what contributes to Black pregnant women anticipating police brutality towards their children and how that might affect them during their pregnancy. So briefly discuss the methods of the study. So as a doctoral student, my colleagues and I conducted a qualitative study among Black pregnant women in and around New Haven, Connecticut, who were at least 18 years of age and self-identified as Black or African American. I'd like to acknowledge that not all people with the capacity for pregnancy identify as women, and I may use the term women throughout the presentation, as that is the term that study participants use to describe themselves. So we conducted one-time individual in-person semi-structured interviews between 2017 and 2018. Interviews lasted less than an hour, and participants were compensated $40 for their time and contribution. We asked interview questions on neighborhood factors, including structural barriers, as well as current and anticipated stresses and experiences of discrimination. In terms of the data analysis, 3 researchers trained and experienced in qualitative research used grounded theory-informed coding as part of a qualitative thematic analysis. And in terms of the co-author's positionality, I'm a biracial woman of color, and my co-authors identify as being white and Black, female and male professors of public health, nursing, and sociology. So here are our findings and quotes from the participants in the study. So we recruited 24 Black pregnant cisgendered women aged 21 to 45 years, and 14 participants were pregnant for the first time. So we found that participants described interactions between Black people and police on multiple levels, including personal, familial, community, and societal. They also described feelings and thoughts that shaped their beliefs regarding whether they and their children would be protected by the police or experience police brutality in the future. So from the narratives in the interviews, we identified 4 overarching themes, and they were experiences that lead to police distrust, anticipating police brutality, stress and fear during pregnancy, and the talk about avoiding police brutality. So participants recounted personal and familial interactions with the police that led them to distrust the police. So one participant stated that if this is the way that she is treated by police, then she was not sure how her son was going to be treated, and she described the following racist interaction with police. The police came in, they saw my husband was drunk. One of the officers wanted to know if my name was on the house, if I own the house, how I own the house, and would I be okay going somewhere else for the night to stay instead of him leaving? And then me insisting that I'm pregnant and I have a young child, I'm not leaving my home. I would prefer that he leaves. And their response, I think had he not been white, they may have been a little bit more harsh, but they're like, well, sir, really we can't allow you to drive. You can come stay at the station with us and have someone pick you up. So I still feel a little bit of discrimination based solely on race, not on economic or other factors. So another participant described a benign interaction with the police in the past, but went on to say that she would not readily trust the police in the future. Other participants described police interactions with their family members, particularly racial profiling by police of male family members. And one participant described how their friend was shot and killed by police during a mental health crisis. So taken as a whole, personal experiences and shared stories shaped participants' participation and trust regarding the police. So these experiences also form the basis from which they conceptualize interactions with the police and how they anticipate future police brutality against their children. And one participant said, So, I mean, in terms of police, I feel like, so I'm the oldest. I have three brothers. I'm always constantly worried about them. I feel fortunate they're okay. But in the back of my mind, I'm always expecting that phone call. I mean, they're great. They're great kids, but I'm always concerned with all the violence that's going on. You know, they could get caught up in something. And so for me to feel that way about my brothers, I can only imagine, you know, my child. I'd like to note that there are even participants who had positive personal interactions with the police also anticipated police brutality against their children. So participants described how this anticipated police brutality caused them stress and fear during their pregnancies. And one participant who knew she was having a son said, "It's a boy. I feel absolutely petrified. Yet my husband's white, so interracial family, and no matter how you explain it, it's just not something I feel he can fully comprehend because he's never going to have those experiences based on the color of his skin. Like he's just not." I still think that literally walking down the street, he's not going to be looked upon or questioned as much as, you know, his black best friend. So I think it's just hard. So this gap between a parent's protection and the possibility of police brutality was a source of stress during pregnancy. And participants described how they had already begun thinking about and planning around having the talk about protecting their children from police brutality and racism, even though their children had not yet been born. And participants described how they struggled with how they were going to approach having the talk. And one participant said, "For me, I didn't have the racial conversation growing up. And so I feel like it's important to have, I want to have the right balance. I don't know what it is, but I don't want to freak my child out completely. But it's like they need to know, right? This could be a reality, right? It wasn't your mum's reality or not in the same way as your father's is, but you know, I do want them to be prepared as possible. But there's just so much going on. It's like, how do you get prepared?" So in summary, for Black pregnant women in our study, anticipation, fear and stress regarding police brutality towards their children occurred before their children were even born. And these findings are consistent with previous research on vigilance about racist encounters and mental health concerns in relation to anticipated negative interactions with the police. Perceptions of police, how police may treat their children were based on personal, familial, community and societal level influences. And even participants who reported positive experiences with the police anticipated brutality towards their children. And this aligns with other research on the contradictory view of police as both providing protection and causing harm. So in conclusion, police brutality is one symptom of systemic racism, and multi-level interventions will be required to address police brutality and its potential adverse effects on parental and infant health. I'd just like to acknowledge my co-authors and funding. And here are resources for how health departments can address police violence and other research. And here is my email address if anyone has any questions later on. Thank you.
Thank you, Dr. Mehra, for those data and that overview. And we really, really appreciate your attention to this important issue. Dr. Sewell, you should have screen sharing privileges, and if you are ready, you can please go ahead and start to share your slides. Let me know if you're having any difficulty.
Okay, I'm about to pull it up. Thank you.
Yep.
Okay. Here you go. So I want to focus today on, honestly, something that I was not necessarily thinking about as I did this work. I study police violence and vulnerable health conditions, many of the things that are on our minds today. And that really is some fairly early understandings of the ways in which gender plays in quite patterned ways in identifying what risk that people who are not necessarily directly, right, they're directly affected or involved in interacting with police, how even they themselves are affected, right? So I want to start in a short version. Is my understanding of these things actually starts with a guy named Amadou Diallo. If you're in New York City or if you're around at the turn of the 21st century, you probably know this story, but he came out of his apartment, he's in New York City, and the police, shot him 41 times, and they were looking for someone else, okay? And what I know is that this anti-police brutality movement, I think, does start with a picture like this. And we have seen this kind of picture over and over again in the last decade. You have someone who was the victim of police violence, and who? His mother, all right? And I think that kind of is where I want to stay today, is that there are communities who are left behind, yes, but there are people who are left behind, and it is never a good thing for a mother to bury her child, but when the state is implicated in that, I think the question of fairness and injustice become that more acute. Usually when we think about these issues, we're considering it from the perspective of our own contact with the police. So we consider this, I talk about this from a stress model, which is, contact in general, this idea that you yourself may be involved as an everyday stressor. If you live in these environments, and I almost exclusively work in urban communities where it's highly walkable, so on and so forth, when these things become regular, you're not just talking about your fear, but it's almost like you're walking out, right? You're walking out and you're surrounded by a cloud of fear, this climate of fear. And I like to, I won't go into a lot of this stuff because I think that the work that we're doing really pays attention to this question. But one of the ones that these components of surveillance stress that got me was
I'm not sure if we've lost Dr. Sewell.
It looks like on our end, she might have got disconnected from the Zoom. So hopefully she can get logged back in. A little technical difficulties.
Thank you, everyone, for your patience as we work through some technological challenges. I will go ahead and text Dr. Sewell offline.
Perfect. Just one of the joys of virtually convening.
While we're waiting and before she's trying to get in. While we're waiting, we did want you to know we factored in a good amount of time for each speaker to provide an overview and to provide their slides because we will be having a moderated panel after each presenter presents, and we've prepared some questions for us to have a discussion with each other as well as all of you. So I don't want people to feel stressed out that we won't have enough time, because we did plan this such that the overview would take about 20 minutes, and that we would then have time for question and answer, our moderated panel discussions, and then some closing remarks. So we've learned also in this digital era that you need to sort of factor in a plan B, a plan C, and a plan D when these technological pieces occur. So we will give them a few more seconds as they've texted to let me know that they're trying to get back in. But to know that we've planned in some cushion of time, and we appreciate your patience.
Can y'all hear me?
Yes, we can. Welcome
Oh,
back.
I'm so sorry. And I have really good internet connection at my house. Obviously, unfortunately, not good enough. But I can shorten. I will shorten what I have to say. Hopefully, you can hear me. Is it
Yeah,
possible for me to share my screen?
You should be able to, and we have time. You do not need to truncate.
Okay. I think maybe either a co-host or yeah, here it goes. Awesome. Thank you. All right, so I won't run roughshod through through this conversation, but I did want to focus on the question of what I was getting at was psychophysiology. What we understand is that contact with the police is stressful. What we understand is that worries, vigilance about whether you may have contact with the police is also stressful. The work that I do focuses whether you live in a place where these things are happening. And the argument that is becoming more and more supported is that just by seeing or being exposed to those two things I mentioned before, someone having contact, you having contact, living in this climate of fear, it actually can work like, you know, hearing a baby cry or hearing someone scream in distress down the street, not you, or when you're playing the video games. That when these things are happening, you may not even see them, but it's going to activate the stress response. You're going to have kind of increase in heart rate, more sweating. You're going to think about, you're going to be more worried and so on and so forth. So again, you can read the work and kind of get at some of this stuff, but I want to talk about that question. And when we think about the idea of police violence and contact, we focus almost exclusively on the people who you're looking at, their eyes, and we need to. We also, however, need to be looking at and thinking about from this perspective of surveillance stress, from the perspective of psychophysiology being activated by someone else who's in distress, whether it's that they're crying out for help or you're seeing injustice or you're seeing unfair treatment, is that there's someone observing this. And in particular, I think about that girl who, and this is actually a protest, a Black Lives Matter protest, but she doesn't know any of these people. She probably is not quite aware of that, even she's at a protest, but she's going to grow up in a world where she could become one of these people. And even if she's not one of those people, right, where she's going to see these types of things occur. And the research that I've done suggests there is as much of a detrimental effect for those who are having interpersonal contact with the police, who are living in these neighborhoods that are happening, as folks who have no clue that it's going on. But the threats of violence are real. The threats towards safety, not from people down the street from you, but from state-sanctioned agents, right, is still a real thing. So I want to stay right here for a minute and skip us all the way into the place where I've gone with this research. We know that there's higher rates of hypertension, higher rates of factors that lead to, I call it the trifecta: cardiovascular disease, diabetes, obesity. These are things that are going to kind of set forth a heart attack. We saw that with Erica Garner years after she started to protest against her father's undue murder. She dies of a heart attack. She's not even 30. Right. And yeah, there's all these things that are going on. But the reality is, if she hadn't lived in this environment, I don't think in the mid-20s that would have been a part of her conversation. She left behind in the process of bringing into this world someone else. We know that boys, we know that men who are experiencing these events, they have higher levels of nervousness, higher levels of worthlessness, higher levels of thinking about, you know, I'm doing all this work and maybe it won't matter. So you can consider 10 blocks. I'm going to show you 10 blocks here. This is from George Floyd Square, which is at 38th in Chicago and Minneapolis. 10 blocks south of this, there's a corner that in 1925, there was a restrictive covenant that was released on this block. That restrictive covenant said that for no conditions at all, you will have someone other than the Caucasian race rent, lease, live on, inhabit, you might even say, think about occupying the property, the building on this parcel, with one exception, if they worked for the owner, if they worked for the renter. So essentially what we're saying is over 100 years ago, because this is when the restrictive covenant was actually expiring, right? So it was already in effect for decades. The parcel had been sold to Henry White by a construction company, Shenandoah Terrace, and this entire part, you see the green that's highlighted, the entire part were all of these parcels that was sold to folks from this suburban construction company to individuals. All of them have these restrictive covenants, all right? 10 blocks south, right, of where George Floyd Square is today, which will become a protected space. At this block today is a 4701 Chicago Ave, Minneapolis, Minnesota, right? If you were to look up this address today, you can do it if you want to. It is the site of Wings Financial Credit Union. All right, 1925, a restrictive covenant was released. It is further stipulated and agreed by and between the parties heretofore themselves, their heirs and assigns, as part of the consideration hereof, that the within described premises shall not be sold, mortgaged, or leased to, or occupied by any person or persons other than members of the Caucasian race. That relationship between police violence, right, and opportunity, particularly the real opportunity that's built into the parcel, living in a place, was established long before George Floyd was even born, possibly before his mother even thought about him being born. And if you look at this corner, across the street is Wells Fargo Bank. Down a little bit is a Health Partners, is an urgent care health center. The entire area is parts of communities. They're food stores. They're nice places. But you know what's in that 10 blocks north? It's where a life was lost in a very unjust way. And what my research suggests is that if you're walking down that block and half of those blocks have some kind of frisk, you know that's normal, right? If there's 2 of 10 of those blocks have use of force, it's normal. Unfortunately, this is in New York City. This is also in Philadelphia. Most of those blocks, on average, Blacks and Latinos are 69% more likely to have force used against them. So this is the microcosm of that walk, right, between George Floyd Square and a parcel and a whole neighborhood that had been given access, all right? Not even 13 years, 15 years after the restrictive covenant was released, this credit union was founded by 7 airline employees, all right? So we have a opportunity structure, all right, that was created from what happened actually a year before.
Oh no, are they frozen again?
Yes, it looks like they are frozen. Hopefully they don't get kicked off. They are still on the participant list though, so, It looks like they just got disconnected. We'll give them a minute here to get logged back in. Sorry, everyone. It just seems like we're having a few Zoom issues, but thank you for sticking with us. Oh, they are still on. So let's see.
They texted they're coming.
Awesome.
And it always seems when they're in the middle of a really important sentence.
I know, on the edge of our seats.
I'm like, ah.
I have never ever been kicked off twice.
Oh, it's okay. And it keeps
One's
happening when you're saying so many important things.
It's a miracle. And all I can say, I'm gonna, you saw that picture, right? So I don't have to show it to you again. It's its own form of trauma. But I'm on my cell phone Wi-Fi. Hopefully we're going to get through the end of this. But what I want to talk to you about is that if you have one additional block, so you're headed to your place of opportunity, right? You're trying to get to the urgent care. You're trying to get some money out of the bank that you have access to. You might gotta, if you know Minneapolis, you're right around where you're coming into a park. So if you know you're getting that last 5 blocks and you see somebody get frisked, you have a higher rate of hypertension, a higher rate of diabetes, a higher rate of body, a higher likelihood of being obese and overweight, of having an asthma episode. I hate to tell you this, but I'm quite literally dealing with an asthma episode as we speak. So in some sense, I'm not going to lie to you, this stuff is quite personal, although I have not had this experience just like that. I haven't walked those 10 blocks and had that extra block. Right now, let's think about that same boy, right? And he had that extra block, but his use of force. You don't need 2 blocks. You just need 1/3 block where someone's being pushed against the wall, or they're being beaten, or held forcibly down on a car, or so on and forth. When he gets to school, right, he's going to be a little nervous going through that metal detector. If they don't stop him, and he's actually in his math class, he's not sitting here thinking about, is it 2 + 2? He's having a little bit more problems. We look at that boy and say he has a behavioral problem. No, he's living in an environment that stresses him out, that pushes against his focus. And so that means that maybe math, right, is not that important to him, and also is a little difficult. And what by the end of you do this 5-10 years, he doesn't feel very good about himself. And this is stuff we know from Minneapolis, we know this from Ferguson, and so on and so forth. We also know, right, that if you're, I'm just driving this home right now, if you're the mother of that boy, right, and you live in a place where this is 10 years prior to the fall of Stop, Question, and Frisk in New York City, which, by the way, happened 1 year before Eric Garner, right, was choked to death, right? So no, Stop, Question, and Frisk falling did not save us. All right, but 10 years before that in New York City, if you live in a neighborhood where at least 3 legal intervention deaths, this means that a medical examiner, a coroner, said it was not anyone's actions except the intervention during the legal process, state-sanctioned process of protecting society, that this person was injured fatally, right? If you just had 3 of them over 10 years, you don't need it every year, all right? You don't need it every day. You need almost a memory of it, okay? If this happened, then women in those neighborhoods compared to their male counterparts have a higher risk of that trifecta. So when I think about these questions, I literally am walking to Wells Fargo. I'm walking to the credit union, and I'm right there at that corner of the park, and I see a cop, and I have not done anything, but I understand what could happen if I look like a George Floyd, if I look like someone who's the mother of a George Floyd, if I don't look like any of them, right? Because in fact, that study actually suggests there's no race-specific effects, it's just women. I'm gonna end there because I really wanna have this conversation with folks. I'm gonna, for the sake of my own digital capacity, I will remove my video, but I'm here, I'm listening, and I think that the conversations we're having now are conversations not about George Floyd. It's not even really about the girl that you looked at, right? It's about the memory of these things, the ways in which these things have been encoded. And I'm going to offer to you, it didn't start in 1999. It didn't start with Rodney King. It didn't start with the Civil Rights Movement. You got to go back, Black Reconstruction era, trying to become first-class citizens, and these rules are created that are going to lock you into disadvantage, not today, not tomorrow, but for lifetimes. And I will wrap up there. I do apologize for our adventure today.
Well, we very much appreciate you and your research, your insights, and your thoughts. Dr. Bond, are you ready?
Yes, I am.
Awesome. The stage is yours.
Thank you. Thank you, Dr. McLemore and the organizers for inviting me to be a part of this very important conversation. As a religious scholar, a womanist ethicist, I have been sitting with this topic for the past few weeks and just thinking about, excited about the conversation, the discussion, and wanting to go deeper even into Dr. Sewell's research. I was listening to Dr. Sewell's research. I was thinking, oh my God, the commonalities, right? So I want to further place our discussion in context with some historical background. First, I look at this work, these issues through a lens of reproductive justice, and I'm going to share my screen. Hopefully all manners of things will go well. Yes, thus far. Okay, so reproductive justice rests on 4 pillars: that every person has the human right to have a child, not have a child, pair the children that they have with the necessary social and economic supports so that their children can not just survive, but to thrive, and the right to expressions of sexuality and gender identity. Why this strategy of reproductive justice? Well, Black women developed the concept of reproductive justice as a strategy to challenge and dismantle white supremacy and population control. It offers a more stringent critique of white supremacy and neoliberalism, and it allows us to bring in this concept of intersectionality, which we get from the legal scholar Kimberly Crenshaw, that says that Black, Indigenous people of color experience multiple forms of oppression simultaneously. We don't live singular lives. We bring our full lived experiences to every experience, every encounter that we have. And so there has been this history of violence against Black, pregnant, capable people. There has been what I call a structural evil against Black bodies, especially that of Black, pregnant, capable people in the US in particular, which began with the transatlantic slave trade. It is an evil that has survived and been sustained through Black people's enslavement, the pre and post antebellum periods, Jim Crow, and up to and including the present time through various forms of reproductive violence, which includes police violence targeted at Black bodies. These structural evils are really situated within the American social, economic, and political systems that were designed to continuously replicate systemic evil against Black bodies through intersectional forms of oppression, including race, gender, and class. And this structural evil is an insidious, continuous thread that runs throughout the lives of Black people, Black communities, owing to the institutionalization of racism, white privilege, and white supremacy. Black, pregnant, capable people especially have bared the brunt of this legacy of evil and human suffering. Despite having to bear the weight of this heavy yoke, Black, pregnant people have persevered. Slavery and historical reproductive and sexual degradation are forms of, I like to think, evil that strike at the very core of Black, pregnant, capable people's sense of humanity, causing a form of moral injury to our moral conscience. And it is from this womanist ethical lens that I really encourage us, as we think about the impact of violence, we include looking at moral injury, because we are bombarded with images of Black bodies violated and or murdered every day by the media through various forms. And long after the cameras are gone, the trauma remains. And Black communities are left with this sense of no justice, and most times a sense that little effort is being made to acknowledge the wrong that was done, the wrong that we have experienced. So we live in a time where media and social media, because now we have the iPhones and we can take pictures and we can experience this in real time. So especially through the social media, it makes it difficult to escape the visual impact of the violence against Black bodies, which means that we cannot escape the injustice and racism even inside our own homes. When Black people witness police violence and killings, they experience a measurable amount of emotional distress and trauma. And it's an emotional distress and trauma to the human psyche because it challenges our deepest moral codes, causing, among other things, feelings of helplessness and outrage and sorrow that we never experience a sense of relief from, or a sense of closure, or a sense of justice from. Black pregnant capable people have been forced to suffer through these myriad forms of reproductive and sexual oppression, and the denial during the enslavement of Black pregnant capable people's ability to be self-determining about their reproduction and sexuality is just one more form of degradation. What could be more evil than to rape and pillage the bodies of Black people, of Black pregnant capable people, and deny them their right to motherhood, their right to parent, and to force them to watch their children being sold and use their reproduction to provide human labor for the slave economy? So Black pregnant capable people's experiences with parenthood, with motherhood, have been historically one of continuous trauma, because our children have never truly belonged to us through the eyes of not just in America, but around the world. So today we continue to see the abuse and exploitation of Black pregnant capable people who are incarcerated and forced to go through labor and delivery and endure unimaginable conditions and circumstances. And so we also see that when we see the murders of Black pregnant capable people's children, because the people who have died at the hands of state-based violence, they had mothers, they had people who gave them life. And so in many respects, these acts of violence at the hands of the state have contributed to, in many respects, turning the wombs of Black pregnant capable people into graveyards. If we apply a reproductive justice lens to the unprecedented murders by law enforcement of Black bodies, we can see how this form of violence has contributed to this sense of turning the wombs of Black pregnant capable people into graveyards owing to the loss of Black life. Those of us working in the fields of public health, reproductive and other social justice movements, and even in the fields of religion and ethics, my field, must become aware of our own sense of moral injury, when the very authorities entrusted to defend and protect betray that duty and instead engage in harm against Black bodies. I was especially struck by Dr. Sewell's research and the connection between living in surveilled areas, police violence, and obesity in particular. In my dissertation research of the reproductive and sexual decision-making of Black Protestant Christian women of reproductive age, the high rates of infertility among Black women and the connection to obesity as a risk factor arose as a prominent issue for a number of my research participants. I want to thank Dr. Sewell because it raises for me the need to include the impact of policing and violence and that sense of moral injury in my expanded research on Black Christian women and reproductive and sexual behaviors. So I want to end there because I'm actually very excited to get into this conversation about solutions and to talk more about how we can bring the concept of moral injury into the discussion.
Thank you so much, Dr. Bond. I really, really appreciate that. Every time I get a chance to hear you speak, I'm just grateful. And thank you for all of our speakers for being able to share your wisdom and your knowledge, your insights and your research. For the City Mats participants, I have to say the being booted off the Zoom is contagious. I got lost there for a couple of seconds. So Dr. Sewell, you are not alone in being kicked off of this talk today. That said, I do want to pivot. I want to transition, take a couple of minutes to talk about and to have the panelists answer some questions that I've prepared, because I think it's really, really important that we go a little bit deeper in our discussion and are able to really, really talk about a deeper dive in this work. I see there's a note in the chat that the sound suddenly has ended for one of our participants. And can I get a thumbs up that y'all still hear me from somebody? I'll take an emoji or whatever. Okay, great, wonderful. Okay, so anyone can answer this question, but I think I would like to hear from you, Dr. Sewell, first. How do we think about policing pregnant bodies more expansively? How can we think about it at the local and the state and the federal level? How should we be thinking about this?
It's honestly, it's a wonderful question. I'll get it in two ways. I usually do three, but for our Wi-Fi challenge space, I'm gonna do two. So the first thing is there has been a shift in how we talk about police violence across time. If you go, back to the kind of mid-20th century, really think about it as organizational. Police are saviors. The controlling crime thing, the rise of mass incarceration. They're coming to the rescue, and even Black communities actively engage police. I live in Atlanta. This is one of the most conservative Black middle class environments. We're saying no, don't, keep the police funded. So I'm not going to jump on that bandwagon regarding the question of funding, because what happened afterwards was that we started to move towards a psychological model, and now we're moving within the trauma model. And when I think about those two models, I start to think about the centered space of the community. So I'm going to give two things. One, what if we actually had a systematized way of counting police violence? We don't. There's over 3,000 counties, XYZ municipalities, For as many that we see, there's as many different laws and ways and procedures of counting this violence. We need a federal, not state, not municipal, we need a federal standard of how it's counted, right? And what we do about it. And the reason why is this: we actually already have that. Legal intervention deaths, security agents, law enforcement officers engaged in protecting the law. Why not count everything else? And why not do it at a way that the state is actually responsible for that? Those things are only counted by doctors. They're only counted at vital statistics when you die. It's too late, all right? And the second one, what if everyone from the day of, I'm not being funny, from the day of birth had some formal link to the psychosocial resources, therapists, so on and so forth. You see this in COVID now. If you did not had a psychologist or therapist, a counselor even before COVID, good luck. They were overworked, they're underpaid, and there are not enough of them, right? So what if we put more in resources and investing into these health service helping, not all health services are helping models, and pay them what they're worth. And then, I'm serious, use tax dollars. Just the way we use tax dollars to pay police, we use tax dollars to make sure that when things don't go wrong with you, that you have a way in which to process those things so that grief doesn't get encoded into your bodies. Those are my two that I would offer.
Thank you for that. Renee or Toni, Dr. Bond or Dr. Mehra, how do we think about policing pregnant bodies more expansively?
Well, I think about even when people show up for services, for healthcare services, particularly Black pregnant capable people, that we remember that the person brings their full selves, their full lived experiences, and to make the connections and to offer those kinds of mental health services, and thinking about the potential impact. I mean, I think it requires on the part of public health professionals, medical professionals, to look at how do you provide healthcare in partnership? How do you provide healthcare in a way that does not just deal with the one issue that that person has presented for care for, but to look at their full lives and to have some knowledge of what is going on for them within their communities, have some sense of the cultural implications, and to look at where we can offer people mental health support to deal with what I think of as that kind of moral injury, sense of moral injury that people experience. I'm thinking about what happened last October, when Deja Stallings in Kansas was, experienced such a just horrific form of violence when the police officer had her, and she was pregnant, had her on the ground, face down, with, the knee, right, in the police officer's knee in her back. And for me, that immediately raised images of when Black pregnant capable people were forced to lay face down during the enslavement and were beaten, and holes were dug in the ground so that their pregnant bellies could be in the hole, right? Not really because there was an interest in saving them, but more of an interest in saving the life that they were carrying to further the US economy. And I think it's important to realize that Black people have that historical remembrance, that just because we're living in contemporary times does not mean that we don't remember the enslavement of our ancestors and the atrocities that we have faced. So we already carry a form of moral injury, if you will. And so this constant violence and murders of Black bodies is just a compilation, it's compiled on top of the remembrance that we already have.
Thank you for that. Dr. Mehra?
Thanks. So I'll just add to the conversation about, I guess, policing in hospitals and how, the presence of police within hospitals, when, patients are interested in finding healthcare but are being harmed, and also around surveillance of pregnant people, especially if they're on public health insurance, and screening for substance abuse and sexually transmitted infections, and then referrals to child protective services. So there's really broadly how pregnant people come into contact with police or policing. And then there's also, I guess, this idea of control too, beyond policing, around forced sterilization of people of color. I think there are many ways that I think people of color can feel policed or surveilled or controlled beyond the police as well.
Yeah, I really appreciate all of the points that you've made. Picking up on the last one, I think it's really important for public health audiences to understand, there's been a long documentation of this kind of surveillance, this kind of control. And I am very much looking forward to the new book that's coming out from Dorothy Roberts about this continuing to expand this discussion around child protective services and mandated reporting. For me as a nurse, really getting people to understand that that is deeply problematic in terms of how that's been deployed disproportionately against Black and Brown people. So, one thing I didn't hear us also talk about was this whole idea of, ICE detention, and thinking about immigration surveillance and how that, in my view, is also yet another, facet of, the sort of policing of pregnant people. And I don't want us to be in front of a public health audience and not bring up that role of immigration and surveillance with pregnant capable people as well. That brings me to the next sort of question around solutions, right? So, I'll let you all popcorn this, but what interventions may resolve the impact of violent policing on pregnant capable people? Well, I think I'll start since I'm the moderator and y'all not unmuting. I know at UCSF and Zuckerberg San Francisco General, there has been a grassroots effort to remove campus police from at least the hospitals and healthcare systems, led by, Afro-Latinx midwives and other midwives of color, because we really believe that the police, presence on campus is very triggering for the people that we serve. And so for me, I think there are ways for us to think about, even in our own institutions, where and how and why there are police presence. When we're trying to create environments where people are trying to seek care. So one intervention that I've appreciated is, these discussions about how do we remove police, or how do we engage them differently, around healthcare and health services provision, such that we are mindful and we're paying attention to community insights around, even the environment in which they are trying to seek care. I think removing police from healthcare institutions, is one intervention that I think we really, really need to seriously engage around. The other is I'm coming to this meeting from Oakland, California, and there has been a really incredible new hotline that's been set up to respond to mental health crises and emergencies. And they operate from 7 p.m. at night to 7 a.m. in the morning. And they have this huge social media campaign, which I'll also put a link into the chat. They've done billboards. They've really done a lot of outreach to social service agencies, such that there is a different number to call, so that police are not dispatched to, emergency checks or wellness checks, that there is actually more appropriate people who can respond. So with that, I'll let you guys unmute and talk, what interventions may resolve this impact of violence and policing on pregnant capable people.
Yeah, I wanted to jump in this education question, right? And then I do think it's, and I'm going to stay there because I think education can do two things. Unfortunately, educated people don't necessarily do things better because they're educated. A lot of times, actually, these high levels of literacy around these social issues give them better ways to defend their place, to defend their privilege, right? And so my first one that I considered was in the schools, right? And to start with kids, we have all these classes that we're required to take before we graduate. What if one of those classes was about, required, not it's an option, but was about these community effects, the ways in which these policies, those are optional classes. And yes, if you're in a great school, you learn about them. One of the things I think that could happen this is a generation, number one is a generational shift that's going to occur, but it's going to give people a wider knowledge base, so that when they're in the news and they're hearing things, a lot of these assumptions that we spend so much time trying to debunk, they're gone, right? The second part of that is that when it comes to the critical point of voting, we don't just trust the folks who have the power to vote. We take a little bit more influence, and I think about this primarily to the question of environmental justice. And I think you can have that conversation around pregnancy completely in that space. We don't have no required class on climate change or environments. People barely know this stuff because we don't even like geography. We don't like physics, right? But if you frame those things through the human lens instead of through the biological, technical lens, it's gonna allow these stories to become more relatable. And I think that socialization, at 18, I can vote. I got my degree, I can go vote. I'm ready to change the world. You don't have to wait until you got a degree or you know more. You're coming in, you know more, and so on and so forth. And then the last part, still in this education part, I learned this. So I don't come from a policy-based discipline. So I was lucky to have advisors that said from the beginning, what's the policy relevance of the questions that you ask? I know you like the school environment. I love going to the student health care center and ain't got to deal with all this other stuff. I don't go anymore, of course. I'm saying I like the advantages of being in a protected institution. But what's the policy relevance of everything you learn? I think if we start to socialize children, and maybe that is the point, I think about children primarily. If we socialize children and think about solutions now, not just hold this information, then the debate I'm going to have, we're not going to have 3 places that finally do it right. There's going to be a monumental shift in the idea of transforming society, not just I want to know more. I know they're broad, but And again, I'm very critical of the educational, effect, but I do think the socialization for the next generation, it starts with people who are capable of pregnancy, putting those emphasis, putting that pressure on schools and so on and so forth. And then again, all the way through, so that we're going to get a cultural, we have gotten a cultural shift, right? We've had it. We need the next one, right? And I do think that's around questions.
Thank you for that. And I completely agree with you as an educator and somebody who spends a lot of time translating my scientific research into policy. I completely agree with you. Dr. Mehra, Dr. Bond, any additional comments that you have?
I don't want to derail the conversation, right? But I do want to, we can think about the policing of Black pregnant capable bodies in a myriad of ways and very expansively, and even, thinking about the ways in which other institutions kind of try to force Black pregnant Black pregnant capable people to conform to white supremacist ideals, even in terms of our sexuality or the denial of our sexuality. And I'm thinking specifically about the Black church as a historic institution that has really policed the bodies of specific, Black women to conform to these notions of what it means to be a respectable Black woman and to conform to these respectability norms around our sexuality, and still promoting antiquated, oppressive theologies around not having, premarital sex and the taboos of sexuality, and not even talking about our bodies. And so, I even think about the role of even medical professionals being enlisted to police the bodies of Black pregnant capable people. And I'm, as a doula, I'm thinking about my very first client just like 5 years ago, and being in the labor and delivery room with them. And after the delivery, having the nurse come and say, well, Mom, have you thought about a form of contraception so that you won't have a future unintended pregnancy? And so I just kind of, my client said, well, no, I'm not interested. And the nurse walked away, and then she came back not 15 minutes later and said, Mom, have you thought about a method of contraception to prevent future unintended pregnancy? We can give you a Depo-Provera shot right now. And I just kind of looked at, I'm like, do you understand that she is in the moment of experiencing the greatest moment of her life, right? Bringing forth life. And you are asking her to make a decision about a method of contraception. And you've made an assumption that this pregnancy was unintended, and her husband's right over there. So I need you to step away and stop harassing my client. And so we have to think about the ways in which medical professionals have been enlisted in this kind of policing of Black pregnant capable bodies as well.
Yeah, thank you for that offering. I have 2 PhD students who are currently examining, this role of, mandated reporting and child welfare, and, how that's all connected to and rooted in and grounded in, a default human status that somehow we all have to exist as humans in the same way. And so I think it's really prescient, and I don't think it was a distraction at all from the question. So thank you for that offering. Let me ask one more question that I would like for all of you to answer, and then we'll open it up to the audience. And people have been putting comments in the chat that I very much appreciate. So if you haven't put your eyes on the chat, please do, because there are great exemplars of different programs around the country that people are working on, and some good ideas. So this last question is a call to action. And I think because we have, public health researchers, we have administrators, we have clinicians, we have practitioners, we have students, we have a whole variety of folks at this session. What can public health department staff, leaders, participants, people who are served by public, what can we do to reduce the impact of policing on pregnant capable people? What should we be doing as a community?
I could share what human impact partners have in terms of what their tools are, particularly for public health organizations and what to do around this issue. So
Can you
they,
tell the audience who they are and what they do.
so I included this in the references or resources as part of the, for my section. I actually have not looked too far into them, but I do like the recommendations that they have, and I can share it with the group as well later. But the things that they recommend are to educate staff who work at public health departments on police violence in terms of data and framing, and talking about having learning working groups and brown bag lunches and training around this issue. And then in terms of within communities, they recommend having listening sessions and community events with community members and community organizations and organizers around how to address this, like community-led solutions for this, as well as working across government agencies with the health and all policies, wanting to convene partners on like school districts, educators, social workers, social services, healthcare, faith, and other partners to find sort of programs and policy solutions to this. And then most of all, as Dr. Sewell was mentioned, to advocate for data collection and reporting on police violence and misconduct. And I can share that link into the chat.
Thank you, appreciate that. Dr. Bond?
Well, first and foremost, to recognize and to continue to frame police violence against Black communities as a public health issue, and equally important, I think, is to also talk about this, and we're seeing this. I think we've seen this with the COVID pandemic too. This ongoing distrust of public health community, and having some more conversation and more education about that distrust of public health, governmental public health, and greater training on implicit bias, and what that means. I think that those are some ways that public health departments can do to address the impact of policing on particularly Black pregnant capable people.
Thank you for that. Any thoughts, Dr. Sewell?
Yeah, you know, I'm actually going to hit back on what y'all been talking about regarding the healthcare professionals. One of the later, I call it negative illness feedbacks, and I generally call what I do negative illness feedbacks, but essentially you got a problem that's created by the system, and then now you don't want to use a system to solve the problem. You never get out of the cycle, okay? So I'm a specific study in Philadelphia. We looked at frisking, super easy, same stuff that you see in the psychological, the cardiovascular kind of effects. But this time we were actually looking at number of times you've gone to the emergency room in the past year, right? So frisking is messing you up in your health. And we found that this is actually out, my co-author, Erin Carrison out of Berkeley and Social Welfare says, hey, we actually see people are less likely to go to the emergency room. I need help, but I won't go if they live in these highly surveilled neighborhoods. Now I'm going to fast forward that to COVID. I was talking to, I'm in Atlanta, I live right in the urban district. And I live on it's not a big, it's one of those roads that you use to get from one side of the city to the next. And all I heard were ambulances. This is that first 4 or 5 months. Now I can tell the difference between the police car and the ambulance. So I'm starting to think, okay, what are they doing? What I found out was that folks would not go to the hospital. And number one, folks were saying not to go, but even very severely, folks in predominantly Black poor communities were not going to the hospital. They would call the emergency medical response team and say, you treat me, but I'm not getting into the ambulance. So they were treating these EMR professionals, they were healthcare professionals, they were treating people like they were doctors in the emergency room, because there was so much distrust of the system in it. And you are also right. I mean, these urban communities, they do not want to go to the hospital in the first place. And then the emergency room ambulances don't come on time, but they don't come for COVID. We're not getting the ambulance. And I think it was powerful to think about that. Which aspects of the healthcare professionals are trusted, are held in esteem and closeness, and which ones aren't. And the fact that entering that door, that's the dividing line. I feel like it gave me some opportunities in which we could, like I said, maybe we invest a little bit more in that aspect, the training and so forth, for parts of care professional industry that disadvantages, aggressively surveil neighborhoods, people live there who need help, right? That they can serve some of those pockets. I think the community and human connection is stronger with the ambulatory healthcare professionals than it is folks who are inside those rooms, inside those halls.
No, I thank you for that offering, because I think it really matters in a lot of interesting ways in terms of, access to care and, what you so importantly, brought out is this trust issue, right? And I think until we really get our heads around that and can think about the other kinds of and alternative structures that can be built, we're going to have to keep wrestling with that sort of tension. I want to trouble this discussion and add one more piece of tension that I think, if we didn't bring it up, I would feel very remiss, because we have public health people who are on this call. And that is this whole idea of, when we think about maternal morbidity and we think about maternal mortality, we look at, the conditions that are associated with it. One thing that gets missed is the incredible work of public health scholar Dr. Maeve Wallace and her team at Tulane University, where we understand that homicide, right, is one of the #1 factors in maternal mortality. And we have to wrestle with what that means, right? That pregnant but women are, most likely to be murdered in a homicide, right? And so as we think through the role of violence and the role of policing and the role of guns in our society, right, we want to also be thinking through that there are other places of contact where we can improve health outcomes or work to improve that. There are public health interventions that we can use, and reduction of gun availability and gun restriction is another piece that we need to talk about. And, when I think about, the criminalization of pregnant people, and when I think about their needs and the normalization, I mean, we heard last Wednesday during the Supreme Court argument, it's a hypothetical about a pregnant person using substances, and should they or should not lose their, bodily autonomy, and should they be managed by a criminal justice system? Like that was allowed to go unchecked during oral arguments, criminalizing people for using substances, right? So I think you're spot on. All of the comments have been very, very helpful in terms of educating future and current citizens, in terms of really understanding some alternative methods. And Dr. Bond, I think you brought up a really, really important, concept of really understanding moral injury and calling it what it is. Right. And I think the more that we can use that kind of language, the more that we can introduce those ideas into the public lexicon, and the more we can actually have really honest conversations about what does it mean to have policing in our society, and what does it mean to have guns in our society. I think we'll get a little bit closer to, trying to improve some outcomes and to reduce the amount of police violence that we see. There's a question in the chat, and I want to open this up to all of our panelists, and I will read it. I think there's a fine line between the videos of police brutality being posted on social media to show what's going on and triggering trauma that ensues. Any thoughts on this or research that you know about that talks about social media effect of recording and sharing police brutality videos? I think this is a really, really important point to make, because the availability of, smartphones and social media has provided documentation where historically, Black people who have lived with police terror have not been believed. And at the same time, I think there's a secondary trauma that occurs at a community level when those videos and those documents are shared. So I am a person who has a no sharing of any kind of violence or brutality. on all my social media channels. And I feel that as a nurse, as a public health informed person, and somebody who has a large platform, I need to be responsible in content that I endorse in my own channels. But I would love to hear what you all think about that. Dr. Sewell?
Yeah, so I'm a caveat this. I normally do not talk about research that has not been peer reviewed. However, unfortunately, I think the research on this is so, and particularly the way we frame it right now within the question of police violence and the trauma stuff is nascent. And there is not a lot of data about this. There is, however, a data set that I found back in the day. You always got to find a data set, but I found a data set. It's a data set of queer people of color from it was a national survey actually. This is coming in 2010 with Social Justice Sexuality Project. And they had this one question. So this is a national survey, but at the end of the survey, they had a philanthropy. They gave Men's Health Crisis their ball. Everybody come in, it's philanthropists within the queer community from all across the nation. They had pen and paper surveys, 300 folks they asked them, not the regular sample, there were 6,000 people there, but just these 300 so folks, have you ever recorded police brutality? It was aggressive policing, they were saying. And in that sample, these are queer, essentially leaders in 2010, it was 40% of them had done so, 40%. So I decided, I was like, this is what? I said, let's run this, the same question, national survey of people of color, regardless of sexuality. I found 1 in 8, this was in 2016, regardless of queer, replicated, same 1 in 8 in 2020. We just got out of the field on this. I was like, but these are just out of the field surveys. Now I'm like, why are the queer people out there videotaping everything? It's exactly what you just said. Nobody believes them in court. All right. So they had put this question on there because people on the street kids were doing this so that they had a defense mechanism. So 2 things shows up. You're right. You do this kind of stuff, you're stressed out. All right. You have contact with the police, you're stressed out. All right. But if you do both, you actually have better health. If you do both. So I thought, now what is going on here? So when we did the survey again, this is a national survey, regardless of sexuality, I found that the folks who were most likely to engage in this activity, so it was 1 out of 12 national, they were the most politically and economically and socially disenfranchised folks. Queer people, more likely. People who were less educated, poor, right? Folks who, listen to this one, didn't vote, didn't register to vote, couldn't vote. You catch this, man. These are folks who are on the edges of society. They're the ones who are saying, listen, something's happening to me. I can't even get into the system, the democratic system, do anything. All I got, what is this camera? All I got, in 2010, they asked the question of, do you have video or audio recordings? We don't even do audio recordings. Do you have a smartphone? So we have graduated, okay? So I do believe the trauma element is there. The political elements cannot be denied because I used to have a 70-inch TV, I no longer do, but I remember 70 inches, I'm about 60 inches. I'm walking around, I'm right there on the scene. It's like I'm right there.
Right.
It's hard to keep thinking about this as someone else's project, someone else's problem, and someone else's solution when you're right there. So the power of the camera is not about, for me, number one, the camera is powerful at a democratic space for folks who actually can go vote, who can be found, who can. Come on, man. Folks who didn't have a driver's license, right? Powerful. And that relationship actually remained between 2016, 2020. And you actually see 2020 even stronger, stronger positive effects. But the stress is there too. But when it comes to levels of self-rated health, much better. I just think, when I think about this, I see this not from the perspective of the observer, but from the person who's taking the video. This is a form of political empowerment. And if they have contact with the criminal justice system. So they are already bearing the burdens of this. What else do they have besides the camera? A lot of them will not do it, right? Yeah. But we're talking about someone You know, in Eric Garner's case, the guy who recorded, he hasn't been in jail. I mean, what I'm trying to tell you, these people on the margin, and all they have is a camera, but they're asking us to vote for them, to think for them, and so on and so forth.
I appreciate those insights. Dr. Bond?
I concur with all that Dr. Sewell has said. The only thing that I would add, yes, it is this kind of, in terms of social political dynamics, it is this kind of source of evidence, right? You see what is happening, right? And it is evidence of what has happened, I think, particularly for Black and Brown communities who historically have not been believed about the forms of violence that we have encountered. But at the same time, I think about, in the midst of everything that was going on with George Floyd and Breonna Taylor, and constantly watching, the news and seeing the videos played over and over and over again, even I needed to take a break, because I realized that there was something that was triggering my own sense of moral injury. And watching these kinds of assaults upon the bodies of Black people, it was bringing up for me, reminiscences of my own trauma and police encounters, and just this overwhelming sense, and a sense of sorrow to witness that happening, but to witness it over and over again. I do agree that there is the power behind the use of social media and smartphones, and using the camera to capture these incidences of violence. But I think we do have to figure out how, what is that fine line, and how do we sit with the emotional trauma, the psychic trauma that people experience over and over again by seeing these videos continuously, especially Black and Brown people.
Yeah. Any thoughts, Dr. Mehra?
Just one quick addition that, the Black pregnant women in our study did mention how seeing news reports of police brutality against Black people in the media did contribute towards their anticipation of, police brutality against their children as well.
I really think that this is an important, question to wrestle with. And, I appreciate the statement that the data are nascent, and that we don't really have really good, data, which tells me, of course, that perhaps maybe we need some students and faculty to be working on that. There's another question in the chat that I think is important that we all address. And it says, what does the racial trend data tell us about experiencing police brutality versus intimate and interpersonal violence? Are we considering non-action or ambivalence for survivor support as violence?
I mean, we do so for discrimination. White silence is white violence. Silence is actually so important. I mean, I think this is the larger conversation around just injustice and prejudice, and who decides to be a part of this fight. And not fighting is a form of injury as well, right? I think when it comes to the trend question, and maybe the very recent pandemic is a good example of this. So people stayed home, so they're with people who they love but are tired of, or maybe people that they don't love and they're tired of, or maybe people that were kind of mean to them, and now they're really mean to them. So rates of domestic violence went up, right? And so now, what do we see on the TV? We don't see anything about this. We think about the family, but there's no actual conversation. There's no picture of what a family looks like at COVID when a woman is getting beaten by their partner and their kids are being abused. You see pictures of the police brutality. You see, right where you're just saying, and we don't see that because people don't want to talk about that so close to home. So I do think it's a form of violence, and I don't think we should rank violence. I think we should think about, how do we solve violence? What are the policy solutions to violence? And so we as a nation, we've come to a call of consciousness around accountability. What does that same call of consciousness look like when the person who needs to be held accountable is living with you, right, and related to you? end it also by saying, I do think we have made a step forward when we think about police violence as the same kind of violence as community violence and intimate partner violence. And maybe that allows us to move a little closer to thinking about the combination between the two. Because when you're getting hit and someone will give you a crime, who you calling? So we're not talking about distinct things, right? So the inaction that we've had against police accountability is the same. It's the same, it's exactly the same. And that's maybe part of the question of policy relevance that we need to continue to think about as a nation, and particularly thinking about for me, pregnancy can't fulfill people, because there's a vulnerability there where if you're not able to even protect the life of someone else who you're supposed to protect, right, as a bodily person, that question of inaction is not just about your injury against you, it's injury against your unborn person, whether you're carrying that person or not.
Yeah.
You know, it's a powerful space. And I do think that's a form of violence.
Yeah, no, I really appreciate that perspective. And, you know, I can't believe I'm about to say this, but I think we have 2 minutes left. And so I want to thank the participants for incredible questions. We will continue to engage on social media as well as in the conference platform if you have additional questions that weren't that you were not unable to ask. And Dr. Mehra, if you don't mind, I would love to give you the last minute as the coordinator of this panel to be able to thank everyone and to wish them well as they continue their day and throughout the end of the conference. Dr. Mehra.
Thank you. So I'd like to thank Dr. McLemore as the moderator, and Dr. Bond and Dr. Sewell for being part of this panel. I think they brought a great deal of sort of personal insight and professional experience with this topic. So I think it was very valuable, not only for me, but hopefully for all of the attendants. So thank you to all the attendees for joining. We had a great participation from all of you today. And we hope that you will, particularly in public health professionals, will think about how you can start to, I guess, address the issue of police violence in communities. And I encourage you to go out to your communities and partner with your community, other departments to move on this issue, to find policies and programs to address this. And I wish you all the best. And yeah, feel free to contact us if you have any questions.
Thank you, Reagan. We'll turn it back to you and the City Match team.
Perfect. Thank you so much, everyone, for joining. What a great conversation. A special thank you to all of our speakers and our moderator today. We really hope for continued dialogue around this really important issue, and we hope all the attendees are taking away things they can do in their own communities to address this issue.